Hi, my name is Dr. Greg Olson, and today we're here to talk about peripheral neuropathy and how to stop the pain of peripheral neuropathy. I've been in practice for 17 years, and I've done over 900 hours of postgraduate training. I'm board certified in chiropractic kinesiology. Currently, I work with a group of about 1,000 doctors across the country who focus on neurologic and metabolic problems such as peripheral neuropathy. Today, I'll be sharing with you some of these problems and their solutions that we've found. So first off, you may want to know what is peripheral neuropathy. Peripheral neuropathy is a problem with the nerves that carry information to the brain and the spinal nerves. This can produce pain, a loss of sensation, inability to control muscles. The true definition, when we break it down, peripheral means further out from the body, distant from the brain and spinal cord, so we're not talking about spinal cord injuries or issues or brain issues. Neuro means the nerves, and pathy means abnormal. So abnormal nerves in the peripheral or outer parts of the body. So the 7 signs of peripheral neuropathy, or how to know if you have peripheral neuropathy, are listed right up here. We look at numbness, burning feet, cramping, sharp or electric pain, pain with walking, difficulty sleeping because of leg discomfort, or prickling or tingling in your extremities. The symptom really depends upon which type of nerve is affected. There's 3 different types of nerve tissue. One is sensory, the other is motor, and the third one is autonomic, and that carries information to the organs and glands. So when we talk about the first category is the sensory fibers. And damage to the sensory fibers can result in changes in sensations such as burning sensations, nerve pain, tingling or numbness, an inability to determine joint position, which can cause incoordination. For many of these neuropathies, the sensation changes often begin in the feet and progress towards the center of the body. Diabetes is a common cause of this type of neuropathy, or sensory neuropathy, and that's usually mostly begins in the feet. The second type of nerve involvement begins with the motor nerves. Damage to the motor fibers can interfere with muscle control, can cause weakness, loss of muscle bulk, loss of dexterity, meaning incoordination, sometimes tripping or bumping into walls. Sometimes cramps are a sign of motor nerve involvement. And other muscle-related symptoms can include, depending upon the area, difficulty breathing or swallowing, difficulty or inability to move a part of the body, falling, it can be from legs buckling or tripping over things, a lack of dexterity, being unable to button a shirt or do the finer motor movements, a lack of muscle control, muscle atrophy, muscles can twitch or begin cramping. Now the third category had to do with autonomic nerves, and these nerves control the involuntary or semi-voluntary functions such as control of the internal organs, blood pressure. Damage to these autonomic nerves can cause abdominal bloating, it can cause blurred vision, constipation, decreased ability to sweat. That would be like on a hot day when other people are sweating, skin just doesn't sweat. Diarrhea, difficulty initiating urination, feeling full after eating a small amount, incomplete bladder emptying, heat intolerance with exertion, it can be impotence in males, nausea or vomiting after meals. Also can include unintentional weight loss, we say more than 5% of the body, and also can be urinary incontinence. So the different nerve fibers that can be involved, the 3 different ones, sensory, motor, and autonomic. But what causes neuropathy? The causes of neuropathy can have varied issues. It can be arthritis, spinal stenosis, bulging discs in the spine affecting the nerves as they come out from the spine, statin drugs, which are oftentimes used for cholesterol and hypertension, diabetes, type 1 or type 2, can be from poor diet, leading to different types of nutritional deficiencies that would be associated with neuropathies. Genetics can also be involved. Most of the time with these, we look at 80% of the involvement is typically lifestyle, 20% may be genetic predisposition. Statin drugs inhibit the formation of cholesterol. It's used to synthesize, cholesterol is used to synthesize coenzyme Q10. That's necessary to generate ATP. ATP, adenosine triphosphate, which is necessary to produce energy for any cell in the body. So that ATP production decreases about 1 year, 1% per year. So as we age, that number increases, which increases the likelihood of there being cellular energy issues, which can lead to this peripheral neuropathy factors. Taking statin medications can suppress that ATP production to the point at which the neurons or the nerve cells cannot maintain their ability to send nerve signals. This is what's called the frequency of firing, or how the nerves transmit their messages, which will cause them to decrease. Okay, so this is perceived by the brain as numbness and tingling, depending upon the exact fiber which is involved. Okay. So statin drug use basically increases peripheral neuropathy risk by 16 times. So another common cause is diabetes. Diabetes has to do with insulin. It's a hormone produced by the pancreas to control blood sugar. Diabetes can be caused by too little insulin, resistance to insulin, or both. And diabetes commonly leads to neuropathy. Basically, what we're looking at is all chronic health conditions seem to have a common thread: oxygen deficiency, neurological issues or misfiring, metabolic imbalances, blood sugar control, cortisol imbalances, hormone imbalances, anemia, autoimmune attacks, and brain imbalances. So when we look at the brain has key areas that are involved with controlling the body. So in that messaging from the brain to the body, we look at things such as neurotransmitters. The brain can't communicate with the gland unless there's a neurological connection and a chemical connection, that chemical connection being neurotransmitters such as dopamine, GABA, serotonin, acetylcholine. So when there is a problem with this feedback loop to the brain, we can get what's called overfiring of the midbrain. So basically we've got fibers going up to the brain sending the messages. Messages to the brain come back down to the midbrain to an area called the mesencephalon. Mesencephalon, if it's overfiring, can contribute to insomnia, light sensitivity, migraines, urinary tract infections, chronic pain, peripheral neuropathy. So part of this process is looking at your lab ranges. When we look at laboratory ranges, we look to see where they fit. Are they in the normal range? Lab ranges are traditionally very broad in their range. And so what we do is we look at what's called functional lab values, which is a narrower range that allows us to see where problems may be developing. So some lab ranges, you're not going to be out unless you're really high or really low in that functional range. It's a tighter range. And for example, blood sugar in the laboratory range traditionally ranges 65 to 110. From a functional standpoint, we look for 85 to 100. Outside of those ranges, we begin to look at what is not working properly. So the critical areas in the metabolic assessment of peripheral neuropathy would be looking at anemia, which affects oxygen carrying capacity to the nerve and its tissues. Blood sugar, which is the fuel supply for the nervous system in the brain. We also look at the gastrointestinal tract and the liver, fatty acid metabolism. All factors with nerve health, neurological health. So as part of a complete and comprehensive peripheral neuropathy workup, we do a series of neurological tests and a series of metabolic tests in order to determine what is the most appropriate course of treatment based upon what the problem is. So a thorough and comprehensive physical exam ensures an accurate diagnosis. These neurological tests can include blood pressure, pulse rate, looking at pulse oxygen, your heart rate and rhythm, saliva pH, reflexes, your eye tests, cranial nerve, tests for balance and coordination. And beyond that, next what we look at is when there's an issue with regard to the brain, we look at the two things that are necessary for that neurological function: fuel and activation. So the fuel is oxygen and blood sugar. Activation has to do with a little bit of what we talked before about these pathways that come up from the brain. So there are different pathways, and there can be problems with those, and different therapies we may use for brain activation, neurological activation. Could be vibration therapy on one side of the body, gentle manipulation on one side of the body. It could be TENS units, heat, ultrasound, traction, oxygen therapy, mirror therapy. So those are some of the key components of that. Additionally, we can use upper body ergometer for that stimulation. Auditory stimulation in one ear, that can be music, a metronome. We can also use what's called auricular stimulation. Auricular stimulation happens when we stimulate areas around the ear, has a very strong correlation or feedback loop to the cerebellum. We also can use what's called a warm caloric in one ear. The fibers in the ear stimulated by warmth, again, strong connection to the cerebellum. Olfactory stimulation, stimulation one side of the nose. Sometimes also different types of visual stimulation and imagery, checkerboard patterns, colors, faces, eye exercises. Other therapy for brain activation, infrared therapy, laser therapy, especially good for chronic nerve damage. We also use things such as a chi exerciser, stimulates the circulation in the body. At times, if there are spinal-related issues, bulging or herniated discs, and similar type problems, we will use a spinal decompression, non-surgical spinal decompression. When we look at the metabolic components, we then move into looking at things such as the cortisol and its hormone, the cortisol hormone balance. We do that through a test called the adrenal stress index. It tells us how the cortisol levels are. But ultimately what happens is all cases are a combination of looking at what's happening neurologically and what's happening metabolically. Neurologically, treatment may end up being 60%, metabolic may be 40%. Most importantly is finding the pieces of the puzzle that need to have correction. Is it the cerebellum? Is it the cortisol? Is there anemia and oxygen deficits? Is there a feedback loop to the midbrain that's causing a problem? Is there hormone imbalance? Is there a blood sugar problem? Is there a structural physical pressure on the nerves that's contributing to this? So correcting these problems in the neurological and metabolic puts the pieces of the puzzle together and allows us to get on the right track and fix the problem and get the peripheral neuropathy doing better. Anyways, I want to thank you for joining me today. This was a nice presentation with regard to what is peripheral neuropathy, neurological and metabolic components related to it. And if you have further questions, you can certainly feel free to contact me. Ultimately, my purpose is to help as many people as possible. And if you're watching this because you need help, I'd like to offer that to you. You can contact our office at 949-859-5192, or you can visit us at AskDrOlson.com. Thank you, and I appreciate your time.